Wolfpack family. I am Reshunda Mahone, the Associate Vice Chancellor for Alumni Engagement and Annual Giving at NC State. There are interesting people to meet no matter where you turn at NC State. I'm hopping on the Wolfline just to see who I might run into. Let's go. How are you doing this morning?
I am doing well, thank you very much. How are you?
I'm doing well also. Exciting about having a chance to sit down with you and ask a few questions about your work. But I'm really curious about your title. Can you tell us a little bit more about your title?
Yeah, so officially I'm a professor of veterinary neurology and neurosurgery here at NC State.
Okay.
But I also hold the Dr. Katie M. Jessing and Rana M. Davidson Distinguished Chair in Gerontology, which is quite the title.
That is quite a title. It is quite a title. Well, congratulations for being I believe this is one of the largest endowed chairs in NC State's history.
Yes, I'm really fortunate.
Wow. So tell me a little bit about your work now that you're holding this distinguished chair.
I have for many years been interested in aging of the nervous system. And so these chronic conditions that happen slowly over time are always more challenging to unravel and try to mitigate. So I've always had this secret interest in it, and it's been quite difficult to get the funding to actually be able to work on this in dogs. Well, that all changed once I got the chair. And so my program initially set out to try to understand how pet dogs, so companion dogs, age with respect to their mobility, their cognition, dogs think too, and their senses. So vision, hearing, and very importantly in dogs, olfaction as well, their sense of smell, and their sense of balance and where their limbs are, what we call their proprioception. And so the question I had is, can we actually quantify changes in all of those different functions without causing any harm at all? So very non-invasive look at how these dogs age over time. And over a period of years, we discovered that not only could we test all these functions in pet dogs, but they actually loved it. And they loved coming because we played games with them. They get treats, they do things for games, and so they really have enjoyed taking part in this study.
Oh, wow.
And so as we did that work, my goals were first of all to see if we could do it safely, then see if we could describe the changes, because if you can describe the changes, you can make discoveries, and then also hopefully we could design clinical trials to test different therapies for different aspects of these changes.
So what is your research? What have you found, or what are the accomplishments thus far in the study?
Okay, I'll try not to talk too much. You must cut me off if I keep on going. So first of all, if we look at mobility first, you know, in people, elderly people fall all the time, and it can be a terrible trigger for a whole series of bad events. And in general, we think, well, dogs are a little bit more stable because they've got a leg in each corner, you know? But the truth is, as they age, they find it more and more difficult to walk across a slick floor, for example. And we found that by standing them on a mat and persuading them to stand still, and that's easier said than done, right? We can actually measure their center of pressure.
Okay.
And so we can see how that moves. Everybody's center of pressure moves with time, but we can look and see how that changes with age, and then how that changes if you've got pain from an arthritic joint, or if you've got problems understanding where your feet are because you've got a disc herniation in your back and things like that. And so we were able to document with this quite straightforward test that elderly dogs do start to sway a lot more, and that if they're painful, that sway changes. You can address that. You can treat pain. So it was allowing us to document a change that we then could perhaps do something about. We also, one of my favorite tests is called the gait speed test. Okay, this sounds silly, but for all of us, our walking speed actually predicts our longevity, our mortality. It is crazy. You need to be walking fast, okay?
And I'm a fast walker.
Oh, well, then you're good.
And especially with heels on. My team will tell you that.
Really?
You can try to catch me with heels. It's impossible. But
probably get 2 years for heel.
So hopefully
heel skill as well. That would be my guess.
I get bonus years. Okay.
But with people, you can just ask them to walk from here to here, their normal pace or as fast as they can. You can ask them to do these things. Dogs, of course, is a bit more tricky. So most dogs, if they walk on a leash, they try to please the person who's walking them.
Right.
They also, some have short legs, some have long legs. There are all those differences. So we actually spent quite a lot of time on this. And ultimately, another one of my postdocs, Ale Mondino, was able to really devise a great test where these dogs are asked to go over a 5-meter distance. So they are distant. We show them a treat. We call their name. They know everybody who works in the lab very well, and they like them, and they know they have treats. And then you retreat with the treat, and you call them, and their leash is let go. And the speed with which they walk that distance actually correlates with a number of different things they do, like how well they do with their cognitive tests, how good their memory is, things like that you wouldn't anticipate.
Now, have you spent all of your time professionally here at NC State?
More or less.
More or less.
So, yes, this is a good place to work.
Okay.
So I went to vet school in Cambridge in the UK. I worked in mixed practice, so seeing large and small animals for a brief period of time. Then I went back to university and did a PhD and a postdoc and surgical training, and the specialist surgical training. And I came out here because there really wasn't much neurology training in England at the time. There was one residency program, and there were more like a handful out here. And so I came out here for that residency training and I've stayed here ever since.
What do you love most about NC State?
I think there are 2 reasons I've stayed here. The first is amazing colleagues.
Okay.
We always say the College of Veterinary Medicine is incredibly collegial, and it really is. It really is. So it's a wonderful professional atmosphere. And the second is I've really been allowed to evolve and grow and change, and I've watched everybody around me do that as well. And so if you weren't allowed to do that, then as you evolved, you would go somewhere else. But if you're allowed to evolve on site, then you stay put. Got a good thing going.
That is good. Well, I hear that the College of Veterinary Medicine is going to be expanding, adding new facilities and new students. How do you feel about this now focused intention on the college and the growth?
It is fantastic to be a part of this, and of course it's job security,
That's
growth
true.
is good. Growth is good. I work on the small animal side, and we've been incredibly fortunate with our amazing specialty hospital that we have. So it's wonderful now to see that the equine side is getting the same thing. It's really wonderful.
That's good. That's good. So is there any advice or, to our alums and friends who are watching this that, would help them as they continue to be great pet parents and can kind of be mindful of the research that you and your team are doing?
Ooh, again, you'd have to stop me if I talk too much. I mean, I think just general advice for pet parents is love your pet.
Love your pet.
And do what makes sense, common sense, regular exercise, of course. Interaction, playing with your pet, even when they get elderly and they can't move so much, they can't hear as well, they can't see as well, kind of shifting what you do with them and being prepared for that change is wonderful. Another piece of advice I would give is that quite often, I find myself saying it as well, as pets slow down and can't do things, we get, they're just getting old. And certainly, they are getting old. And there are many aspects of getting old that you can't change, but there are some aspects you can. And so if you suddenly think that they really can't walk like they used to be able to do, it's worth taking them to the vet and trying to figure out why. It could be a matter of pain medications that are needed, but it could be something completely different. And so it's really worth seeking help, I would say.
Thank you for that advice, and thank you for joining. I'm glad we ran into each other on our Wolfline trip around the college, and so we are so grateful for the work and the research that you're doing and how you are helping not only our companion animals have healthy lives, but how you help teach the next generation and really use your research to find those think and do challenges that only NC State can solve. So
thank you very much for that. That's really made my bus ride today.
there we go.